that. We kind of pinch that little area there and find out where the natural crease is. Make just a tiny step. Go in here. Are you okay?
Mm-hmm.
This is some of the numbing medicine we'll be putting in there. It's called tumescence.
Okay.
And it has some medicine that burns just a little bit, so this is a little tender for the first little bit. Spread out a little bit tumescence. This first part's going to help kind of break down some of the fatty cells a little bit like we want to. And we're above the muscle layer in the neck here, and that allows us to keep that nerve that goes to your lower lip safe.